Hey everyone, welcome to our deep dive. This one's for you, our fellow medical microbiologists, and I think you're really going to find this one interesting.
Yeah, this should be good.
So today we're diving into syphilis. And yeah, I know what you're thinking, but hold on, because this isn't going to be just the basic stuff. We're going deep into the latest guidelines.
Right.
And the source for all this great info is the World Health Organization's AWARE publication. Access, watch, reserve.
Oh, yeah, for sure.
We're specifically looking at the chapter on sexually transmitted infections.
That's a good one. A really useful resource for anyone dealing with syphilis. Lots of info in there.
Absolutely. And that's exactly why we're here to break it all down for you.
Yeah.
To really get those key points out of the AWARE guidelines.
Yeah.
Syphilis is making a comeback, right? It's actually on the rise globally. And it's not just about the initial symptoms we all know. The possibility of long-term complications, that's what makes syphilis a real concern.
Definitely. And, syphilis can be so tricky, like especially that latent phase. It's a silent threat, It can be hanging around undetected and still be transmissible.
Okay, so let's start with the basics. What exactly causes syphilis?
So the culprit is Treponema pallidum, subspecies pallidum. It's a spirochete, and actually it's known for being really difficult to culture.
Oh, interesting.
Yeah. And this specific subspecies, that's what sets syphilis apart from other treponematoses, things like yaws or Begel, which are caused by, different subspecies of T. pallidum.
Ah, okay. So it's kind of like a family of bacteria, each specializing in different things.
Exactly. Now, when we talk about syphilis, we often categorize it based on how long the infection's been going on and the stage it's in. So early syphilis, that usually means infections less than 2 years. Late syphilis, that's for infections 2 years or more.
Okay, that makes sense.
And within each of those categories, you've got different stages: primary, secondary, and tertiary.
Right.
And each stage has its own set of clinical signs and symptoms. It can get complicated.
And then, of course, there's that latent stage, which can have, no symptoms at all. That's got to be a nightmare for diagnostics and public health.
Absolutely. It is. Even though it's clinically silent, it can still be transmitted. And if you don't treat it, it can progress to those later stages, with those serious complications we talked about. It's a real silent spreader.
Okay, so we've identified the culprit, got it categorized. Now, how does syphilis actually show up in patients?
That's where it gets, a little tricky. Syphilis is notorious for mimicking other diseases.
Ah, so it can be a real chameleon, changing its appearance.
Exactly. It's been called the great imitator. So let's start with primary syphilis. The first thing you often see is a chancre. It's painless, hard, kind of ulcer-like sore.
Okay.
And usually it pops up at the site of the infection. The problem is people often don't even notice it.
Oh, really? Why is that?
Well, because it doesn't hurt. And especially in women, they can form in places that are hard to see.
I see. So that means a lot of cases probably get missed, and that
Yeah.
just helps it spread silently, right?
You got it. Now, if syphilis isn't treated, it can move on to the secondary stage. That's when things get more diverse, more widespread. You might see a rash, fever, swollen lymph nodes. It can even affect other organs, like the liver, the eyes, even the meninges.
Wow. Okay, so it really is a chameleon. What if it progresses even further without treatment? Gets into those late stages.
Then it gets serious. Late syphilis can really damage your organs. We're talking about the heart, brain, skin, bones. You can have cardiovascular problems, neurological issues, and even gummas.
Gummas.
Yeah, they're these destructive lesions that can damage all sorts of different tissues.
That sounds rough.
Yeah.
And of course, we have to remember congenital syphilis too, right? When it's passed from a pregnant woman to her baby.
Absolutely. It's a serious concern. Congenital syphilis can lead to stillbirth, prematurity, and even if the baby survives, they could have developmental issues.
That's heartbreaking. Early detection and treatment during pregnancy, that's got to be vital to prevent that.
Definitely, absolutely crucial.
Okay, so we've got this super complex infection, lots of different ways it can present, and it can cause serious problems. How do we actually diagnose it in the lab?
That's where lab testing is crucial. The WHO, in their AWARE guidelines, they recommend a two-step process for syphilis testing. You use both treponemal and non-treponemal tests.
Can you break down the difference between those two types of tests?
Sure. So treponemal tests, those are things like the FDA ABS, TPPA, or TPHA. They look for antibodies specifically targeting Treponema pallidum antigens. They're very sensitive and really good at confirming exposure to syphilis.
So if a treponemal test is positive, It means the person has been exposed to syphilis at some point, but not necessarily that they have an active infection right now.
Exactly. That's the key point. And that's where non-treponemal tests come in. These tests, like the RPR and VDRL, they detect different antibodies that react to cardiolipin. It's a substance that's released when cells are damaged by syphilis.
Gotcha.
And the levels of these antibodies, they go up and down depending on how active the infection is. So that makes them really useful for figuring out how someone is responding to treatment.
Okay, so treponemal tests tell us about exposure, and non-treponemal tests give us a snapshot of what's happening with the infection right now and how well treatment is working.
Precisely. And the WHO, in those AWARE guidelines, they really stress that the best approach is to start with a rapid treponemal test and then confirm with a non-treponemal test. That way you can diagnose and start treating on the same day.
Oh, that's smart.
It's really important for stopping transmission and preventing complications.
Makes sense. It seems like streamlining that process is key, especially given the public health impact of syphilis. Are there times when those standard tests aren't enough, though?
Yeah, sometimes you need to dig a little deeper. Like if you suspect it's secondary or tertiary syphilis and it depends on the patient's symptoms, you might need to do some more investigating.
I see. So you have to tailor your approach to each patient and what they're experiencing.
You got it. You really need to see the whole picture, like what stage the infection is in and whether there might be any complications.
And that's where microbiology tests come in.
Right. You don't always need them for primary syphilis, but they can be crucial for confirming you've got T. pallidum when it's a later stage, or if things look a little different than usual.
Okay, so what are the gold standard methods for finding the bacteria directly?
Dark field microscopy and nucleic acid amplification tests, NATs for short, those are the go-to methods. Dark field helps you see the T. pallidum under a special microscope, and NATs look for its DNA in samples from lesions.
So those are the tests that give you definitive proof, especially when things are unclear or you need that extra confirmation.
Exactly. They're really helpful when you have unusual presentations or you suspect complications that the blood tests might not show clearly.
Are there any other lab tests that might be needed to get a complete picture of a patient with suspected syphilis?
Yeah, if you think the syphilis might have spread to the central nervous system, we call that neurosyphilis, you'd do a lumbar puncture to check the cerebrospinal fluid.
Okay. And what are you looking for in the cerebrospinal fluid?
Well, in neurosyphilis, you usually see more white blood cells and higher protein levels than normal.
Ah, so it's another piece of the puzzle. It helps confirm the diagnosis and figure out how bad the infection is, especially if there are neurological symptoms.
Exactly. Neurosyphilis can have really bad consequences if you don't treat it, so catching it early is vital.
What about imaging? Does that play a role in diagnosing syphilis?
Usually you don't need imaging like X-rays or CT scans to diagnose syphilis itself, but they can be helpful if you're concerned about specific complications, especially in the later stages.
So imaging is more for assessing the damage caused by syphilis rather than finding the infection itself?
Right. It helps you see how much the organs are affected and make decisions about the best way to treat it, especially if there are heart or brain problems.
Okay, so let's talk about treatment. What's the best way to deal with this bacterium, especially considering all the potential damage it can do in the long run?
The good news is syphilis is treatable. The AWARE guidelines from the WHO have clear recommendations on how to manage it effectively. The key takeaway here is that we need to treat every case of syphilis, even if there are no symptoms.
Even if there are no symptoms, why is that so important?
Well, even without symptoms, people can still spread the infection to others. Plus, treating it early can stop those long-term complications that can really affect people's lives.
So it's a proactive approach. You're aiming to stop the chain of transmission and prevent future suffering.
Exactly. It's not just about treating the individual, it's about protecting public health, too.
So what does the WHO recommend as the first-line treatment for syphilis?
Penicillin. It's still the gold standard for treating all stages of syphilis. It's been effective for a long time, and importantly, there haven't been any reports of T. pallidum becoming resistant to penicillin.
That's reassuring to hear, especially these days with so much antibiotic resistance. But I imagine the exact penicillin regimen depends on how advanced the infection is.
You're absolutely right. The AWARE guidelines lay out different treatment approaches based on the stage and how the infection is presenting.
Can you walk us through those different regimens? Like what are the dosages and how long does treatment last?
Of course. For early syphilis, the recommended treatment is a single dose of benzathine benzyl penicillin.
Just one dose. That's pretty straightforward. What's the usual dose for that?
The AWARE guidelines recommend 2.4 million units given intramuscularly for adults with early syphilis.
And what if someone is allergic to penicillin? What are the alternatives?
In cases of penicillin allergy, we can use doxycycline, but it's important to remember that doxycycline is not recommended for pregnant women.
Right, of course. What's the typical dosage and duration for doxycycline?
For early syphilis, the AWARE guidelines say 100 milligrams orally twice a day for 14 days.
Okay, so there are options for both people who can tolerate penicillin and those who can't. What about the treatment for late syphilis?
For late syphilis, or if we're unsure how long the infection's been going on, benzylpenicillin is still the best choice. But we give it as a weekly dose, 2.4 million units intramuscularly, for 3 weeks in a row.
3 weeks, okay. And what about neurosyphilis? Is the treatment different for that?
Yes, neurosyphilis needs a more aggressive approach. We use aqueous crystalline penicillin G for neurosyphilis given intravenously. The dosage is 18 to 24 million units per day, divided into doses every 4 hours for 10 to 14 days.
Wow, so you really have to hit neurosyphilis hard to stop it from causing lasting damage. What if a pregnant woman is diagnosed with syphilis? How does her treatment differ?
Pregnant women with syphilis should also be treated with penicillin, following the same regimens as non-pregnant adults, based on the stage of the infection. The goal is to prevent congenital syphilis and protect both the mother and the baby.
So early detection and treatment during pregnancy are crucial to stop it from spreading to the fetus.
Absolutely. It's one of the most important things when managing syphilis in pregnant women.
Now, we've talked about the treatment regimens, but how do we track how well the treatment is working?
We monitor the response to treatment by repeating those non-treponemal tests, like the RPR that we talked about earlier. We want to see at least a 4-fold decrease in the titer within 3 to 6 months for early syphilis and 6 to 12 months for late syphilis. That drop tells us the treatment is working and the infection is clearing.
So it's not just a matter of giving medication and hoping for the best. You're actively tracking the patient's progress and making adjustments if needed.
Exactly. Monitoring is key to ensuring successful treatment and preventing relapses or complications.
Okay, before we wrap up this part of our deep dive, I want to shift gears a little bit and talk about the pathophysiology of syphilis.
Sure, understanding how syphilis works inside the body can help us understand how it shows up in patients and why it can have such serious consequences.
So, after T. pallidum subspecies pallidum gets into the body, usually through sexual contact, what happens next?
The bacteria start multiplying and spreading locally, which leads to that characteristic painless chancre forming at the entry point. Even without treatment, the chancre often heals on its own, which can unfortunately give people a false sense of security.
Right, it's like it tricks them into thinking everything's fine when the infection is actually just getting started.
Exactly. Even while the initial chancre is healing, the bacteria can spread through the bloodstream and lymphatic system, reaching different organs and tissues.
So even though the outward signs might disappear, the battle is still raging inside.
That's a great way to put it. And it's the silent spread that leads to the many different ways secondary syphilis can show up, as the bacteria set up shop in different parts of the body.
And if it's not treated, it can then go into the latent phase, hiding out in various tissues, sometimes for years, before potentially coming back and causing the serious complications of late syphilis.
Exactly. The latent phase is a critical point in the disease because it's a time of silent progression, where the bacteria are quietly causing damage even though there are no symptoms.
And of course, we can't forget about congenital syphilis, which happens when the bacteria cross the placenta during pregnancy. The severity of the infection in the baby depends on things like when the mother was infected during her pregnancy, her immune response, and whether or not she received treatment. This look into the pathophysiology of syphilis has really highlighted the dynamic back and forth between the bacteria and the host's immune system. It's a constant battle, and understanding the different stages of this battle is crucial for effective diagnosis and treatment.
I agree. It's a fascinating, although complex, area of study that continues to give us new insights into how syphilis evades the immune system and survives in the body.
Now, let's zoom out and talk about the epidemiology of syphilis. We mentioned that syphilis rates are rising globally, but what's driving this resurgence?
That's a complex question. There's no one single answer. There are several factors at play, like changes in sexual behavior, for instance, more casual sex and less condom use. Also, there are barriers to healthcare access, particularly for marginalized populations.
So it's not just individual choices, but also social and structural issues that make it hard for people to access prevention, testing, and treatment.
Exactly. And these factors are playing out differently in different parts of the world, leading to variations in how common syphilis is and which populations are most affected.
Are there any specific groups that are disproportionately affected by syphilis?
Yes, men who have sex with men, or MSM, are still a high-risk group, as are people living with HIV. We're also seeing worrying increases in syphilis among women, especially women of childbearing age, which raises concerns about the potential for congenital syphilis.
And that's especially worrying because of the risk of congenital syphilis, right?
Absolutely. With syphilis rates rising among women, we need to be extra vigilant about prenatal care and testing.
Okay, so with syphilis rates increasing around the world, what does this mean for public health?
Well, syphilis isn't just a personal health problem. It's a societal issue with wide-ranging effects. Untreated syphilis can lead to serious complications, which can strain healthcare systems.
Right, so we're talking about more hospitalizations, the need for long-term care, and even lost productivity.
Exactly. And then there's the impact on future generations. Congenital syphilis can have lifelong consequences for children, affecting their physical and cognitive development. It's a tragedy we need to do everything we can to prevent.
All right, so syphilis is a major public health concern. What strategies are being used to combat its spread and reduce its impact?
That's a great question. There are a few key approaches that are proving to be effective in tackling syphilis. First and foremost, we need to improve access to testing and treatment. That means making testing more convenient and affordable and ensuring people who test positive can get the medication they need right away.
And that includes breaking down any stigma or barriers that might stop people from getting care.
Absolutely. We need to create welcoming and non-judgmental environments for everyone who seeks STI testing and treatment.
What about prevention? How can we prevent people from getting infected in the first place?
That's where public health education and awareness campaigns come in. We need to be open and honest about syphilis, its risks, and how to prevent it.
So empowering people with the knowledge and tools to protect themselves.
Exactly. And that includes promoting condom use, encouraging people to talk to their partners about their sexual health, and getting tested regularly if they're at risk.
What about partner notification? I know that's important for controlling STI outbreaks.
You're right. When someone tests positive for syphilis, it's crucial to tell their sexual partners so they can get tested and treated too. This helps stop the chain of transmission and prevent further spread.
And I imagine those can be difficult conversations to have.
They can be, but they're a vital step in protecting both the individual and the community.
Okay, so we've talked about testing, treatment, and prevention. Are there any other new approaches being explored in the fight against syphilis?
Yes. Researchers are constantly working on new tools and technologies to combat this persistent infection. One exciting area is rapid point-of-care testing. Imagine being able to get syphilis test results in minutes, right there in the clinic, or even at home.
That'd be amazing. It would make testing so much more accessible and could really help with early diagnosis and treatment.
Exactly. And there's also research going on into new biomarkers for syphilis. Finding specific molecules that reliably indicate an infection, even in the latent phase, could completely change how we diagnose and monitor the disease.
It would be like a molecular spotlight that could illuminate those hidden syphilis bacteria.
I like that analogy.
Yeah.
And there's also research into new treatments, especially for those who are allergic to penicillin or for whom penicillin isn't available.
So making sure everyone has access to effective and safe treatment options no matter what.
Exactly. And of course, researchers are continuously studying the social and behavioral factors that influence syphilis transmission. Understanding these factors is crucial for developing effective public health interventions that can reduce the impact of syphilis in different communities.
It's amazing how syphilis research spans from the molecular level all the way to the societal level, highlighting the interconnectedness of infectious diseases and the need for a multi-pronged approach.
Absolutely. It's a reminder that scientific advancements and public health strategies need to work together if we want to be successful in combating syphilis and other infectious threats.
Well said. Now, before we move on to the last part of our deep dives, let's take a moment to acknowledge the incredible resilience of Treponema pallidum as a pathogen. Despite decades of research and effective treatments like penicillin, syphilis continues to persist and make a comeback globally. What makes this bacterium so good at surviving and thriving in the human body?
That's a fascinating question that goes to the core of what makes syphilis such a tricky opponent. One factor is its unique ability to evade the immune system. T. pallidum has developed several ways to avoid being detected and destroyed by the host's defenses. Things like antigenic variation and the ability to hide inside host cells.
So it's a master of disguise, constantly changing its appearance and finding shelter from the immune system.
Exactly. This stealth mode allows T. pallidum to travel in the bloodstream unnoticed, spreading to various organs and tissues, and even crossing the placenta during pregnancy.
And that's key to how it manages to create those long-lasting infections and cause those serious complications we've been discussing.
Exactly. Another fascinating thing about T. pallidum is its ability to hang out inside host cells. It can get into lots of different types of cells, including endothelial cells, fibroblasts, and even macrophages. Those are the very cells that are supposed to destroy invading pathogens.
So it's not just hiding from the immune system, it's actually taking shelter in the enemy's base.
Exactly. This tactic of surviving inside cells allows T. pallidum to avoid being detected by the immune system, and it probably plays a role in its ability to lay low in tissues for years before potentially becoming active again.
This intracellular survival strategy is something scientists are really interested in, right? They're trying to figure out exactly how T. pallidum interacts with host cells and avoids being destroyed inside them.
You're absolutely right. Figuring out these interactions could lead to new ways to treat syphilis and stop the bacteria from surviving and causing disease.
It's amazing how much we still don't know about this ancient bacteria, even though we've been fighting syphilis for centuries.
That's what's so great about science. There's always something new to discover, especially when dealing with complex pathogens like T. pallidum.
This deep dive has definitely made me more curious about the research being done on T. pallidum's unique biology and what it means for diagnosing, treating, and preventing syphilis.
I encourage you to explore more. There are lots of fascinating studies happening right now trying to uncover the secrets of the sneaky spirochete and come up with new ways to fight syphilis.
I'm definitely going to look into the latest research. And with that, I want to thank you for sharing your expertise with us today. It's been a really eye-opening journey into the world of syphilis, and I feel much more prepared to face the challenges this infection presents.
The pleasure was all mine. Remember, knowledge is our most powerful tool against infectious diseases. The more we know about pathogens like T. pallidum, the better equipped we'll be to diagnose, treat, and prevent the diseases they cause.
Well said. And to our listeners, thank you for joining us on this deep dive into the amazing world of syphilis. Stay curious, stay informed, and let's keep pushing the boundaries of scientific knowledge.